A recent IRDAI report reveals that health insurers paid out just 71.3% of the 1.2 lakh crore rupees in claims filed during financial year 2024, reflecting challenges in claim approvals and customer satisfaction. Now, this marks a slight decline in the claim settlement ratio there compared to previous years, reflecting the ongoing challenges in the health insurance sector when it comes to approving claims and meeting customer expectations. Over 3 crore claims were filed, totaling 1.1 lakh crore rupees, with 18 lakh claims worth 6,290 crore rupees still unresolved. Insurers processed 82% of claims by number, but only 71.3% by value. A significant portion, which is 15,100 crore rupees, was disallowed due to policy conditions, with 36 lakh claims worth over 10,000 crore rupees were rejected and 20 lakh claims totaling around 7,500 crore rupees are pending. Public sector insurers collected about 40,993 crore rupees in premiums, but their claims ratio was the highest at 103%. Now, private insurers had a lower claims ratio of 88.7%, with standalone health insurers performing best at 64.7%. Now, viewers, this situation raises an important question. How much longer can this system continue to operate with so many unresolved claims and complaints? Consumers are in desperate need of better transparency and a more customer-friendly approach. In the end, while health insurance is meant to offer a safety net, it often feels like a gamble for the average policyholder. Let's in fact go across to Shubhamoy Bhattacharjee, who's a consulting editor, The Business Standard. He joins me with this News9 special. A very warm welcome to you, Mr. Bhattacharjee. You heard me. A report by the insurance regulator states that insurance companies have denied 11% of health insurance claims and had 6% of claims pending as of March 2024. My question to you, sir, is what do you think are the main reasons behind the sharp rise in health insurance claim rejections in FY24?
There are 2 points basically. One is obviously that the claims universe or the health insurance universe is rising. So when it's rising, we are yet to see a long-term trend developing. Between last year and this year, the claims, the health insurance sector has actually expanded. And I expect that the expansion will be even more in the years to come. So we will see a trend rate of claims a bit later. However, you're concerned about the fact that there's a large percentage of claims being rejected is a fair assessment. It's also showing up in terms of the anecdotal experience of the people. Now, what's happening here? Essentially, health insurance, and the problem is more with the standalone health insurance companies. What's happening with them? As you realize, insurance is a capital-intensive sector, which means that they have to put away a large percentage of their capital for providing for the health everything that they would want to pay for. So, for instance, management expense. In all the companies, management expenses, and that includes commission for getting the business, has gone up to 37%. Now, out of every 100 rupee, 37 rupee is going in for claims for management expenses, and then there is the provision for other expenses. The headroom that is available for paying out a claim is considerably reduced. So essentially, what you're getting is that the people, the health companies are paying a lesser percentage of their claims than what you would get, say, from the public sector companies. Public sector companies are not the best of comparisons because they are not required to look at what is the solvency ratio and all that. These companies have to. So overall, the problem that comes along is that we are seeing that there is a high demand for capital. These companies don't have that capital. And as a result, the claims that they are looking at are getting more strongly, stiffly assessed and are getting rejected. There's also the hospital issue that we can talk about next, I mean, in subsequently in this program. Yeah.
I also want you to stress on this, and I'm going to repeat myself and ask you this. You know, the report highlights that health insurance claims worth 26,000 crore rupees were disallowed in FY24, which is a 19.10% increase from the previous year. Please kindly do tell us what led to this, yearly rise.
So the other part of the problem is the hospitals. There's a very interesting platform that the government of India has built, which is the National Health Claims Exchange, where hospitals are supposed to put the data on what they consider as the right medicine, the prices for room care, the prices for doctor care. All insurance companies are there on this platform. It is a platform where you and I can also go and look at what is happening to my health claim, the data on that. But no hospital, and I'm saying this with authority, no hospital out of the 60,000 hospitals in India have registered on this health insurance, on this platform that has been set up by Government of India. So what does it mean? There's a lack of transparency. The hospitals are not saying what is the rate at which they are charging for the same sort of treatment. So people are getting shortchanged. People might be going to an hospital, getting reference from their friends, from whatever, but they're not able to assess that which hospital provides what sort of benefit at what sort of price. And lack of that means that the health insurers are also much more leery. They want to say that if this hospital can provide it at this rate, why is another hospital providing at a higher rate? So essentially, between the health insurers who are providing less money, I said it in the first question, that they're providing less money to settle health claims, and the hospitals which are providing no transparent data about what is the price at which they will pay for the health claim of a person, you and I, as the persons who's taking out health insurance, is feeling cheated. Yes.